So next, I'm excited to welcome Geno Dakhlian, a physical therapist we work closely with here at Boston Children's. Every time I speak with Ms. Dakhlian, I walk away with a deeper appreciation for pelvic health and its importance in overall care for our extra-fee patients. Megan helped launch Boston's Pediatric Pelvic Health program and brings a wealth of experience in treating children with complex pelvic and urologic conditions.
And I'll just say, as the slides are getting pulled up, I want to thank George for his talk and sharing in really such a moving way around, what I heard from him is we can get to thriving, but sometimes it's a long road and it's a long journey. And really to get there, that's where hopefully you can have the opportunity to meet with a physical therapist. And where I wanted to focus around my talk today is that with physical therapy, we really are here as partners and supporting you throughout your journey and through different phases in your life. So physical therapy may play a different role depending on where you are within your age, your lifespan, and your development. Yeah, perfect. And just as we're talking about the role of physical therapy, especially working with individuals with bladder exstrophy, I want to be able to think there's a lot where we've developed this work through. I have a wonderful team at Boston Children's Hospital, as well as our collaboration that we've had with other physical therapists at other hospitals. So Sarah Cooper, who's here from Philadelphia, and Caroline Miller, who we kind of work closely together with, really talking about how we're managing and working with individuals with bladder exstrophy. All right, got it. So when we think about more specifically with physical therapy and pediatric physical therapy, we are really trying to optimize function and development and think about the different developmental lifespan and how we can support gross motor development. And this is really thinking about how can we support independence, being able to increase participation and play. And all of this is supporting readiness skills to be able to be more functionally independent and be able to improve strength, endurance, thinking about their core. And so ultimately, as pediatric physical therapists, we want to be able to assist each child in achieving what their maximum potential is, and really being able to think about what that looks like at home, at school, when they're participating with their peers. And a lot of that is going to do different work between their coordination, their developmental, their developmental, and being able to think about also different activities of daily living. There. Oh, too far now. Okay. And then when we think about pelvic floor physical therapy, so our pelvic floor there's several different muscles that really are working in coordination with our core muscles, our hip muscles, our diaphragm, that are really supporting bowel and bladder function. And for pelvic floor physical therapy specifically, we're really being able to think about teaching the awareness of those muscles, helping to build some coordination, some control, being able to isolate contractions of the pelvic floor, relax, and ultimately thinking about how that muscular function, how that muscular endurance is supporting continence and control of your bowel and bladder. And when we really think about coming together for working with individuals with bladder exstrophy, PT can take different roles and different hats. And so a lot of it throughout the lifespan, we're all thinking about our posture, our coordination, because this is going to impact how we're going to the bathroom. But oftentimes there are pretty extensive surgeries that are occurring that's going to impact those muscles and how those muscles are working. And the physical therapist can really think about there's some key developmental stages that help to support the development of those muscles and how we may need to address that. And then certainly as kids are getting a little bit older, being able to have more of a pelvic floor focus on being able to support continence and different strategies for bowel and bladder. And so from a developmental perspective, even though we don't expect our infants to be continent, there are a lot of key developmental skills that help to support the development of our postural control muscles as well as our pelvic floor muscles, all of which contribute to our future health of our pelvic floor muscles and health that's kind of supporting our bowel and bladder function. And so when sometimes our development might get interrupted with whether it's different procedures, surgeries, but also just how those muscles are kind of coming together, we can think about supporting from a physical therapy standpoint to help to achieve some of those age-appropriate developmental milestones. So I wanted to just be able to highlight some of those key things that we really want to be able to focus on that help to support our pelvic floor development. And so early on at 3 months, we're developing midline skills. We're coming together. That's starting to activate our core muscles. As from 6 months, we start to do more hands to feet play. This is a really important developmental skill where we're bringing together more core activation. We're starting to encourage more and more tummy time where we're developing a lot of our spinal extensor muscles. It's helping to develop the spinal curves within our body. We have some emerging sitting skills. So thinking about how we're going to in the future be able to sit on the toilet. So all of these are really important early on that we want to be able to help support from a developmental perspective. As we get to more 9 months old, hopefully we're having more independence with our sitting. We're able to gain stability and control. We're starting some transitional movements and pulling to stand. And then around 12 months, and really there's going to be a typical range for development, being able to start to develop some early mobility skills for gaining some independence and exploring your environment that supports our cognitive development, as well as some of those readiness and early skills for getting to the point where we could take ourselves to the bathroom. And then around 15 months, we start to get some more squatting and being able to kind of move up and down. And squatting is actually such a good movement for our pelvic floor. It's really some of the foundation where we get some of that key stability as well as motion and mobility from our pelvic floor. And as we get older and older, being able to sustain that squat position, we might be able to play in a squat position. We're doing some controlled transitions. And then really as we're getting over the next year or two, being able to think about putting together sequences of motor patterns and putting those together so that we have those skills to think about the readiness for toilet training. And then going into a little bit more specifically, so we have pelvic floor physical therapy, and then there's a smaller subset of more pediatric pelvic floor physical therapists. And this is physical therapists that are trained in both pediatrics as well as pelvic floor. And they're putting together their knowledge of the pelvic floor anatomy and bowel and bladder function, and as well as taking in those key developmental milestones. And when we think about pediatric pelvic floor physical therapy, we now might be thinking more specifically around bowel and bladder control and strategies to start to support both emptying and continence. And so this tends to start around 5 to 7 years, and there could be some variability based on a child's readiness and their own development. But any time we're thinking about doing a pelvic floor physical therapy evaluation, we really want to take into the entire system. So we're thinking about their whole musculoskeletal piece. We're thinking about what their development is and how all of this is going to impact what the function is. And being able to focus on a lot of hip and core strengthening, being able to make sure we have good range of motion of those hips, and being able to think about posture, control, endurance. Our breathing mechanics are really important. So our diaphragm and our pelvic floor, we want them to work together in synergy. So focusing a lot on breathing strategies. As many as you know that can be really significant scars and how that can impact how our muscles are working together. And so thinking about sometimes doing some scar management strategies, and really all of this is building in coordination and awareness that's going to really more specifically support our pelvic floor. And oftentimes you may have heard of biofeedback, but that can be a tool that we can use to help to build more awareness of the pelvic floor. So give some sensory and visual input of the pelvic floor as we're going through some different exercises. And so really just to wrap things up, thinking about physical therapy throughout the lifespan is, there are opportunities that you might have more of a pediatric focused physical therapist, being able to support development, being able to optimize gross motor skills, development coordination, or a more pelvic floor focused therapist. Ideally, if you're younger, a pediatric pelvic floor physical therapist. Admittedly, that can be a challenge and a barrier since there's a small number of us, but we're continuing to train and grow more people. But really thinking about strategies to optimize, what each individual's needs are. And physical therapy can occur throughout different settings, whether it's in the hospital, being able to support right after surgery, thinking about readiness for going home, early intervention. Often, I didn't include this in the slide, but school settings, thinking about how your school day is going to look, or coming to regular outpatient appointments for supporting that, or meeting with a physical therapist when you're coming to meet with your team through a multidisciplinary clinic. All right. And thank you.